Hello everyone, now let us discuss about modifier 22, 23, 25 and 26 with examples. Now coming to modifier 33, which indicates preventive services. When the primary purpose of the service is the delivery of an evidence-based service in accordance with an US Preventive Service Task Force A or B rating in effect. In simple terms, the US Preventive Service Task Force, it will categorize the visits into A or B category. So either visits which come under A or B rating or other preventive services which are identified in preventive services mandates, which are either legislative or regulatory. Then the service may be identified by appending modifier 33, preventive service, to the procedure code. And for separately reported services specially identified as preventive, the modifier should not be used. You will understand better if you look at the example. In simple terms, 33 modifier is indicated to suggest a preventive service has been done. The modifier 33 is applied to indicate that a preventive or screening service has been taken place, and the modifier may waive a patient's copay, deductible and co-insurance so that there is no cost sharing. And this modifier is only used on the claims for commercial players such as BCBS, CIGNA, TUFTS, etc. And the modifier 33 does not have to be appended to those services that are inherently preventive. Certain CPTs are called as preventive medicine services. For those CPTs which are inherently preventive, there is no need to append the 33 modifier. That is, for those CPTs you should not append 33 modifier. Other than those CPTs, the modifier 33 is applied to indicate that a preventive or screening service has been taken place. Now let us see an example. A high risk for sexually transmitted infection, a high risk patient presents to the clinic for the screening but has some complaints as well. The primary reason service is screening. The reason for visit is screening. He has other complaints also. So in this case, you can bill an E&M, established patient 99213, low level, and to this you can append the 33 modifier. Along with that, you can use Z codes which indicate Z11.3, screening for STIs, and Z72.51 to indicate high risk sexual behavior. High risk heterosexual behavior. So 33 modifier is indicated or appended to an outpatient D&M service to indicate a preventive service or screening has been done. Let us see one more example. CPT code 45378, it indicates colonoscopy. Colonoscopy may be performed for the 50-year-old asymptomatic individual as a routine screening for colorectal cancer. In this case, the colonoscopy is performed for preventive screening and you should append 33 modifier to this procedure code along with V76.51. However, a colonoscopy using this same code may be performed. This is another scenario when the colonoscopy is performed in response to symptoms which a person exhibits. In this case, this service represents diagnostic colonoscopy, not a screening colonoscopy. And the diagnosis code would be one which would signify the symptoms exhibited, and modifier 33 would not be appended. Even when they perform colonoscopy, when colonoscopy is performed for routine screening purpose, then you can append 33 modifier along with colonoscopy CPT. But when the colonoscopy is performed for diagnostic purpose, you should not append 33 modifier. Services where 33 modifier is not appended. When a separately submitted service is inherently preventive, modifier 33 is not used. And for routine immunizations recommended for persons living in United States to prevent communicable diseases are inherently preventive. So those services which are inherently preventive, to those services you should not append 33 modifier. Here you can see the example. Preventive medicine services, which are office visit services, they are represented by the codes 993812 to 99387 indicates new patient and 993912 to 99397 indicate established patient. And these are counseling codes 994012 to 99404 and 99406 to 99412. They are inherently preventive. These CPTs are inherently preventive. Therefore, 33 modifiers should not be appended along with these CPTs. Similarly, CPT code for screening mammography is inherently preventive. Therefore, modifier 33 would not be used. One more important point is Medicare does not accept 33 modifier. Even for Medicare patients also you should not code 33 modifier. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.